Inviting me to speak today, and Annabelle, I'm definitely going to take some of those tips home with me. That was a great talk. So this is me, and I've been asked to talk about the thyroid. So the thyroid gland sits in your neck. It's a gland that looks like a butterfly. It weighs about 20 grams in weight ordinarily, which is about 4 large raspberries, and it's about 2 inches across. The reason this gland is important is that it secretes hormones. So the hormones are thyroid hormones, and the thyroid starts secreting these hormones when the baby is inside the tummy, so from 12 weeks onwards. And the hormones that the gland secretes is thyroxine, what we call T4, and triiodothyronine, T3. Thyroid hormones are important because it helps regulate breathing, heart rate, metabolism, menstrual cycle, body temperature, blood pressure, and even mood. So this is a image of how the body controls how much thyroid hormone is produced from this butterfly gland in the neck. So ultimately, it's about your brain. So this is a part of the brain that sits at the bottom called the hypothalamus, and it secretes a small hormone called TRH, which then stimulates another hormone to be produced from the pituitary gland. And the pituitary gland is a tiny gland that sits just under at the bottom of the brain here. And that gland secretes TSH that then acts on the thyroid gland to produce the thyroid hormones. So there's certain times in your life where you have a lot of need for thyroid hormones. That includes when you're sort of a baby, so infancy, during puberty, and also pregnancy. But throughout your whole life, you will need thyroid hormones. And the reason we're discussing this today, as sort of quite a few of you will know, is that it's one of the most common hormone problems in children with Down syndrome. And it can affect any sort of age group, but it's more frequent compared to the general population. So this is a general image taken from this website about the thyroid gland. So when there's too little thyroid hormones, we call that hypothyroidism, an underactive thyroid. And it can be associated with the gland increasing in size, so that's called a goiter. And it can be associated with symptoms that are associated with low thyroid hormone levels. So this can include weight gain, feeling tired, a lower heart rate, muscle weakness, constipation, dry skin, and hair loss. So this is what we, as sort of endocrinologists, sort of look at and think about all the time when we're thinking about the thyroid gland and the hormones that we measure in clinic. So if your thyroid is not working, so we call that hypothyroidism, primary hypothyroidism, then what happens is that you have no T4 or T3, and as a result of that, the brain detects low levels and it tries to push that gland to produce more. So what you see when you take blood is that you see a high TSH level and a low T4 level. So that tells you the problem is in the gland. And as a result of that, the treatment is therefore to replace the hormone in the form of levothyroxine. So what happens when it's too high? So this is what we call an overactive thyroid, so we call it hyperthyroidism. And again, this can be sort of associated with an enlargement of the gland. and you can have associated clinical features or associated with this. So the enlargement of the gland and also bulging of the eyes. This can also be associated with weight loss, a rapid heart rate, increased sweating, increased appetite, and also changes in your bowel habit. So what we look at in this case, so you have an increased thyroid hormone from the thyroid gland. As a result, the brain senses there's too much. So therefore, the brain says, okay, I need to shut down the TSH. So what you see in this case is you see high T4 levels, but associated with a low TSH. And this is how we diagnose what's hyperthyroidism and what's hypothyroidism. We always link the T4 measurements with the TSH to really understand what's going on. And the treatment is to essentially block the production of thyroid hormones, so that's the medical treatment. And if we generally try and keep that stable on therapy and see whether the thyroid gland either normalizes or burns out, and if not, then doctors would consider second-line treatment in the form of what we call radioiodine treatment or surgery. So this is a very complicated slide showing how we interpret levels when, so it's always a combination of measuring, thinking about the TSH, how that correlates with the T4 levels, and making a decision about what needs to be done. So this just gives a guidance on management of blood tests when it's related to the thyroid gland. And what's important is that we know what to do with the thyroid and thyroid hormone tests. And also there is a good guidelines for all of this when it comes to Down syndrome. So I've put the link to the Down Syndrome Association guidance when it comes to thyroid and well-being, and also the Down Syndrome Medical Interest Group, and some of their guidelines are on those website links. So we already understand that people with Down syndrome have an increased risk to thyroid disease. And as a result of that, we already have guidelines when children should be monitored for thyroid problems. So everyone, regardless whether you have Down syndrome or not, will undergo the National Newborn Screening Program. So this is a blood spot that is taken about, when you're about 3 days of age, and it applies to everyone. And that will tell you whether your TSH is high, so identifying children with hypothyroidism. So then children with Down syndrome should have another screening test between 4 to 6 months of age. And this is a relatively new recommendation based on the high incidence of hypothyroidism within the first few months of life. And following on from that at 12 months of age, and then on an annual basis. Or if there are symptoms suggestive of thyroid problems, that then will be screened or bloods will be taken ad hoc.
Yeah.
So thyroid disorders are just one of several endocrine and metabolic issues associated with Down syndrome, others being weight and diabetes, growth and puberty. And as you may have heard in the morning about our lab, we work with hormones, which are the chemical messengers of the body, and how that affects healthy weight. And you've also heard about DS21, where I work with Professor Stridham as part of a study to think about hormones and health and weight. And this is important, obviously, to sort of really understand how lifestyle factors such as sleep, diet and exercise and medical factors influence the development of conditions associated with Down syndrome. So that was my talk. Thank you very much.